Hello, I'm Hong Yu. I will discuss the past, present, and outlook for public health, the history of public health, some significant events in history, and the possibilities for future will all be covered in this presentation. At the same time, I will go over ideas like health equality, social determinants of health, and the core functions of public health. So let's start with some background information. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choice of society. Organizations, public and private communities, and individuals, people's health within an area or nation is closely tied to public health. Major disease prevention, safety, and health surveillance, as well as health promotion and education, are all included in public health. There are two ways to approach the question concerning the public health philosophy. The first is to think about the public health policy and planning goals from the perspective of justice. Equity and efficiency are the issues under the discussion here. Another point is that the relationship between the public interests and individual laboratory is discussed while talking about the public health policies and programs. For instance, what policies should be conducted by the government when people have different ethical values? The value of public health is reduced death and disease, increase economic efficiency, enhance quality of life, and advance society in the 20th century. Similar to the Christian views, public health seeks to improve people's quality of life, their community's quality of life, and their overall well-being. Social determinants of health. So, they are unrelated to an individual's biology. They are unrelated to genes. So here are some examples of the social determinants of health. Let's pick a few to focus on. The first one, economic stability, income. People with low income typically lack funds to pay for their medical expenditures, which would make therapy less effective. Furthermore, those with low earnings frequently lack access to fresh, healthful foods and choose for convenience foods. As a result, the body's ability to replenish nutrients is compromised. Next one, education. Education's primary objective is to influence people's cultural development and way of life. Health and lifestyle decisions go hand in hand. Education affects a person's knowledge of healthcare, willingness to take charge of their health, and desire for a better quality of life. Neighborhood and physical environment, like housing. Poor housing conditions in rural locations may raise the risk of conditions like asthma. The size of a person's house and the size of their body correspond. Long period of time spent in small settings can make a person feel depressed, which heightens physiological stress. Community and social contact discrimination. So if someone is exposed to a discrimination environment for an extended period of time, both their physical and mental health will suffer. Studies have found a connection between perceived bias and severe depression. Discrimination and the prevalence of hypertension also have a positive link. The next term is health equity, which is an important concept. There are well-known differences in the health status of different populations by utilizing numerators and denominators that represent the entire population being compared, it is crucial to capture this difference. So health inequalities are disparities between various population groups in terms of health outcomes, access to care, and health factors as a result of social or economic inequalities. From a Christian point of view, equality is a very important concept. So God has given everyone the same rights and he loves everyone selflessly. Therefore, as a Christian, it is all more important to emphasize health equality and work towards that goal. Now, now let's consider why health equality matters. Everyone wants to be healthy and happy in their life, and having good health is one indicator of happiness. One can learn a lot about how people view a country by examining its health equality and the preventable health disparities between its various segments. People can understand why there are systematic gaps and offer solutions by comparing health equality between nations and between various groups within nations. As a result, certain populations' worse health is caused by social institutions rather than just bad luck. As a result, it promotes health equality by lowering unnecessary health disparity both domestically and internationally. This is a global issue with a shared objective. The roles of governmental and non-governmental institutions in public health. Diverse relationships are the foundation of current public health practice. So public health is supported in large part by communities, healthcare delivery system, employers and enterprise, the media and academic working with the Ministry of Health, overseeing joint projects and programs, testing out novel methods of service delivery involving communities, building human resource, and stressing infrastructure and the information system are all part of the role that non-government organizations play in promoting global health and strengthening health systems in order to improve health while achieving other goals, such as fostering job stability, strengthening neighborhood safety, and increasing transit options. The health in all policies approach to policy creation looks at how policies decisions spanning several sectors might be made. Let's talk about three core public health functions. The core functions of public health include assessment, policy development, and assurance. So the assessment requires a community-based health profile, diagnosing and investigating community health problems, that is, 1 and 2 of the 10 EPHS. This is a professional community situation assessment. The policy development process involves providing people with information about health issues, mobilizing community partnerships, and developing viable policies. That is 3 to 6 of the 10 essential public health services. The process of policy formulation involves many links, and the people's right to know must be guaranteed. Assurance links to 6 to 10 of the 10 essential public health services. It is necessary to ensure the enforcement of the laws and regulations, to ensure the provision of public health protection for people, to evaluate the effectiveness of service, and to propose a solution to new problems in a timely manner. Ensuring people's health and safety involves many aspects and must be considered carefully. So here is a graphic timeline I made for major events in the history of public health. Three of these achievements deserve attention: tobacco control, the use of vacancies, and environmental protection. First one, tobacco control. So, evidence-based policies and interventions undertaken by federal, state, and local public health authorities have considerably decreased tobacco use. Despite the advancement, tobacco smoking still has an annual economic cost of about 133 billion, including lost productivity and healthcare expense. So we still need to pay high attention to tobacco control. The role of vacancies. In my opinion, the launch of vacancy is an important moment in the history of public health. So few medical procedures have an overall impact on population health and well-being compared to immunizations. In the US, children are routinely immunized against 60 diseases that can be prevented by vaccines. Vaccinations are now given throughout the life. Additionally, immunization can drastically lower the medical expense while shielding people from the risk of disease-related suffering and disease. One of the most economical investments in health is immunization. The last one, environmental achievement. So, the new modifications to the Clean Air Act, which include requirements for the protection of clean air in these significant natural regions, further perceive the air quality and visibility in national parks and the wilderness. The Great Lake provide drinking water for 23 million Americans are now being cleaned up after the United States and Canada signed the International Great Lakes Water Quality Agreement. According to the US EPA, recycling programs and aligned initiatives has increased the national recycling rate by 3 times, and all air toxins in the US have significantly decreased. In the 1990s, only one-third of the US metro regions fulfilled air quality standards. Today, two-thirds do. So here is a brief list of some other major achievements in the history of public health. I think the current challenge facing public health and public practice is mental health crisis. So the scissors in mental health is simple to ignore. The majority of population's mental health needs are not being satisfied even in wealthy countries. Like nearly 100% of needs are unmet in many developing nations. At some point in their lives, about 1 in 4 persons will experience neurological disease. The majority of mental problems started around adolescence, but this is also the time when they are most frequently disregarded. 75% of individuals with mental problems in the United States are under the age of 24. Additionally, mental illness in young adults can last throughout the maturity. As a result, maintaining people's mental health is crucial to public health, and those working in the field of public health strive to stop the advancement of primary mental disease and intervene early in their development. 3 strategies for handling a mental health seizures can be considered. First, everyone should receive better mental health education, develop positive physiological qualities in people, enhance their overall quality, encourage personality development, and teach them how to handle negative emotions. Second, individuals should act quickly to seek out physiological care for mental illness. There is some evidence that physical therapy is helpful, notably in lowering suicidality-related behaviors and substance use in borderline personality disorder from studies of adults, including young adults. The goal of treating mental disease also includes training qualified physiological counselors, and enhancing their professional capabilities. Third, promote healthy diet and exercise among the general population. Because of the high rates of obesity and inactivity, people with multiple mental disease have much shorter life expectancies than the general population. Studies have revealed that intake of fiber, fresh fruit, and vegetables is linked to a lower risk of depression, and that a progressive increasing dietary index is connected with an increased prevalence of depression. Separately, the study discovered that the sedentary behavior and the low level of physical exercise were common among persons with severe depression. Consequently, regular exercise and a healthy diet are two things that can help avoid mental disease. Now let's think about the future of the public health. Let's discuss the talents needed by future public health practitioners. Analytical skills. Practitioners in public health are able to assess and separate out dependable and accurate data, attempt to determine the community's current state of health and the variables affecting it. Additionally, adhere to ethical standards when processing data. Policymaking planning skills. Public health professionals can help their community's overall health. They can create workable, dependable plans and continually enhance the program to raise community members' quality of life. Communication skills have the linguistic and cultural professional necessary to collect data from the general population, have a range of communication abilities to professionally and publicly convey health messages, cultural competence, ability to implement policies while taking into account the diversity and effect of both individual and group diversity. Community dimensions of practice skills. Public health professionals are capable of identifying connections that influence community health. They can collaborate with neighborhood organizations to advance health. The ability to conduct research based on the community interaction is crucial for epidemiology analysis. Public health science skills. It is important for public health professionals to describe their field on a scientific basis. They ought to be skilled in the applications and use of public health science. Financial planning and management skills. A crucial component of public health practice is financial budgeting. Public health professionals should become familiar with financing sources, disseminate details about funding requests, and create budgets, leadership, and thinking systems. So to enhance the program an individual performs, public health professionals should improve their ability and concentrate on bigger picture. Humans still have a lot to contribute to the field of public health because it is so closely tied to human life. However, I believe that in the next 25 years, food safety will be the most significant advancement in public health. People's life and food are too closely entwined. Human suffering is caused by foodborne illness, which also lower productivity, wages, and treat competitiveness and eventually makes poverty worse. The food system may be threatened by changes in weather, consumption habits, or food production. Therefore, I believe that public health system maintain priority for the next 25 years will be to address the issues of food safety, Food issues cannot be resolved just by one organization. To create a system for food safety, governments and institutions should collaborate while utilizing the resource of academic, community, and civil society. The promotion of food safety education should also receive focus. Promoting healthy eating practice and safe food handling practice can successfully stop the spread of foodborne illness. The final stage in guaranteeing food safety is laboratory testing of food. Health institutions and organizations should keep upgrading their contemporary testing tools, periodically adopt new testing techniques, and staff their testing departments with people who have strong technical skills. So that's all. Thank you for your listening.